Which of the following is most associated with increased risk of the venous thromboembolism? That means which is responsible for venous thromboembolism? Here are the options. Options are diabetes mellitus, IV cannula, hyperthyroidism, tamoxifen, and amiodarone. So what may be the option? So let's see the venous thromboembolism. There are different type of the risk factor. Actually, the risk factor develop when there is a foreign body in the venous system, or when there is the stasis of the stasis. So first of all, when there is a foreign body in a vessel, or when there is the stasis of the blood in somewhere area, when there is increased different type of the factor in the blood, coagulation factor in the blood. So this also causes the venous thromboembolism, including the malignancy. In malignancy, different type of the substances are released from the tumor and also causes the venous thromboembolism. So first of all, advancing age, that means the increasing age. So when age increases in this condition, venous thromboembolism may be developed. In case of the obesity, also develop. The family history of venous thromboembolism. Family history is important for any type of the disease. Pregnancy, another cause. In pregnancy, different type of the protein increase, different type of the clotting factor increase, and different type of the plasma protein increase from the usually released from the liver. Immobility is another cause. In case of the immobility, the circulation usually decreases, and in this condition there is chance of the venous thromboembolism. Also there is hospitalization is one form of the immobility. Also the anesthesia. In anesthesia, different type of the drug used, and also this is the immobilized condition. So this point also there is chance of development of the venous thromboembolism. Also there is central venous catheter. Here this is the central venous catheter. Then malignancy, another cause. Thrombophilia, that means the activated protein C resistance or protein C and S deficiency. Sometimes in patient congenitally protein C and protein S absent from the person, and in this condition also there is increased risk of thromboembolism, because the protein C and protein S, they are natural anticoagulant. Also in case of the heart failure, what develop? In heart failure there is decrease the speed of the blood circulation. Also the antiphospholipid antibody syndrome, in this condition also there is development of the venous thromboembolism. Also the Behçet's disease, polycythemia, and nephrotic syndrome, they are also responsible for development of the venous thromboembolism. This is a snapshot directly taken from the Bailey and Lab, chapter number 62. And here we can see the different type of risk factor of thromboembolism is obesity, varicose vein, immobility, pregnancy, puerperium, high dose of the estrogen therapy, that means the hormone replacement therapy, SRT, and previous deep vein thrombosis or pulmonary embolism, and thrombophilia. So they are the risk factor for development of the venous thromboembolism. That means any cause which is responsible for stasis of the blood, or there is increased substances in the blood, such as the malignancy. So such type of condition usually increased risk of venous thromboembolism. There is the another snapshot from Bailey and Lab, and here we can see the trauma, surgery, malignancy, heart failure, myocardial infection, paralysis of the lower limb, that means the immobility, also the infection, inflammatory bowel disease, nephrotic syndrome, polycythemia, and paraproteinemia. So these are the cause of the venous thromboembolism. So which is the increased risk of the venous thromboembolism? Here the option diabetes, cannula, hyperthyroidism, tamoxifen. So tamoxifen is a drug, and this drug also responsible for the increased thromboembolism. Other option here are such as the amiodarone and hyperthyroidism. In hyperthyroidism there is the hyperdynamic circulation, that means circulation increase. So when circulation increase, there is no chance of the venous thromboembolism. In case of IV cannula usually have no risk or very little risk, which is negligible. Also the diabetes, it is not responsible for the thromboembolism. So only here it is the tamoxifen.